It's disappointing that the debate we're having here about home care and in-home care is not about substantive reform. It's about tweaks around the edges, around administrative things. Now, we won't be voting against those where we can see the merit in the measures that are being put forward as being sensible when you consider that there's something like $1 billion of unspent funds, unspent home care funds sitting in different providers' accounts as of 30 June 2020, and possibly higher given some consumers might not have been able to use their funds during COVID. This is a sensible thing to look at, and we haven't opposed it. But I think the disappointment is that this isn't more substantive reform, particularly when the Royal Commission, more than a year ago, raised issues around home care and the sorts of reforms that we need. It's all very well to rattle off numbers, you know, we've had this many extra home care places, but the reality in communities like mine, in the Blue Mountains and Hawkesbury, is there are people waiting for someone to die or to go into aged care so they can access a package, because this is not a demand-driven system. It's a system with a certain number of packages at certain levels, and you have to wait for one to become available. And for the last 2 years, there's been more than 100,000 people consistently, sometimes more, never less, for 2 years waiting for their turn to come up. And that is not a system that you can say, she'll be right, because it's not right. And it's causing pain, and at times, and I've heard members on the other side talk about how important it is to support people in their homes because you can keep them healthier for longer in their homes than perhaps in other ways. And it's not good enough to say, yeah, sorry, you'll get one, but you have to wait. You know, these are the sorts of realities that people are facing, and just to hear members rattle off and say, oh, we've done lots, it's not making a difference yet. There are more than 100,000 people. Right now, it's 102,000 people. They're the figures we got from the last quarter. We're still waiting for the September quarter's figures to come out, because funnily enough, we haven't seen those yet. Consistently, this government has delayed the release of figures that tell us exactly what that number is. And that is a disgrace. The people who are waiting for home care packages are those who want to retain their independence, and they deserve that. They want to be able to have just enough care to be in their own home. I met with a wonderful woman, Joyce, the other day. She does have a home care package, and that gives her some access to some gardening that supports her. And as she gets older, she wants to know that the extra support she needs is going to be there. I'm sure, Deputy Speaker, you would hope that for family members, for your constituents. I certainly hope that for mine. I guess I'm disappointed that at the end of this year, I know we've had COVID, but COVID is not an excuse for not acting on a whole lot of things. There has been more than a year waiting to get a response to the Interim Royal Commission, and we hear suggestions of a suite of packages that one of the members opposite foreshadowed. Well, let's see it. Show us what's going to come, because right now people don't have a lot of hope that what's going to come is going to do the job. And I think it's particularly pertinent to remind people that over the past 3 years, more than 30,000 elderly Australians have died waiting for their home care package. They've died waiting for help in their home. It just isn't good enough, Deputy Speaker. Over the past 2 years, more than 32,000 older Australians have entered aged care earlier than they had hoped to because they weren't able to access a home care package. Now, and we all know that it is a much more economic premise to be providing in-home care rather than putting people in a position of having no choice but to enter residential care. Deputy Speaker, there's been work done in relation to this bill by aged care accountant Stuart Brown, and they have looked at how much of the current system is unspent, and that's where the $1 billion comes from. And they also looked at the average unspent funds per client, and they put it at approximately $7,000. Now, these are people who are experts in home aged care and aged care accounting. And that's one of the rationales for why this bill's going ahead and why we're supporting it. But those same accountants have also found that the recipients of home care packages across Australia are getting, on average, less than 10 hours of care each 14 days. Now, that's data that they presented to the Royal Commission, and that's data from the 2018-19 financial year. And of that time, of that 10 hours across 14 days, they found that 6.6 minutes was provided by registered nurses in in-home care, 1.8 minutes was by enrolled or other licensed nurses, and just more than 7 minutes a fortnight of care was provided by allied health professionals. And this is something that even the Australian Health Department First Assistant Secretary, Dr. Nicholas Hartland, said that he found those results unexpected. It's not what anyone should have expected. So while we will support this bill going through, we need to see much more change before any of us in this place can have the confidence that the in-home care packages are available to people who need them, when they need them, and that they get a level of care that they require under those packages.